This is Health Unabashed on Healthcare Now Radio. Health Unabashed is where healthcare meets innovation, insight, and impact. We engage top industry minds to explore the future of health and wellness, from visionary thinking to sustainable models, policy reform to frontline delivery, and ultimately the real-world impact on public health. I'm Greg Masters, co-host and executive producer, alongside my partner in conversation, the ever-curious digital health aficionado, author, editor, global thought leader, and industry steward, Gil Bash. Together, we bring you the people, ideas, and movements reshaping healthcare, not with hype, but with purpose and passion. On today's episode, Gil sits with Dr. Sai Praveen Haranath, pulmonologist, intensivist, public health champion, and one of global medicine's most compelling voices at the intersection of technology, access, and human-centered care. Dr. Haranath holds an MBBS from Madras Medical College and a Master of Public Health from the University of Connecticut. Go Huskies! Based in Hyderabad, India, he serves as senior consultant in pulmonary and critical care at Apollo Hospitals, India's largest integrated health system, and as medical director of Apollo HealthAxis, one of India's first and most expansive tele-ICU programs. In this conversation, Dr. Haranath explores why 80% of critical care may already be deliverable remotely, how ancient virtues like empathy and compassion must anchor the most advanced technologies, and why India's young workforce may be positioned to care for the aging populations of the world. Now, with no further ado, Gil, the mic is yours.
Greg, thank you for the introduction. And also, I want to acknowledge that people should tune into your two programs. You have obviously the very popular Pop Health Week that you and Fred Goldstein have been partnering on for many, many years. It's one of the pioneering shows on Healthcare Now Radio. You also, with Jim Tate, a favorite of many, have a new show also airing right now that deals with obviously the up-and-coming topic of psychedelic therapies. And this is something that has really been on the tip of people's tongues for a few years now. Certainly with the government policy shifting, it's getting much more attention. So I want to wish you our very, very best on your new show. Obviously, your historic show, Pop Health Week, needs no best of luck. It's already an established leadership show with a pretty big audience. And I want to thank you also for setting the tone for tonight. We have a really incredible guest. We're actually preparing the show late at night because we have a bit of a time zone shift. We're actually recording this show with a very special guest who is based in Hyderabad, India. If you're not familiar with Hyderabad, it really is a very special city in India. It's known as the high-tech city of the nation, and it's been developed as such. And so I was privileged to be there about 2 months ago, speaking at BioAsia 2026, a small gathering. Not that there are small gatherings in India with its population, a small intimate gathering of about 4,000 people. And I had the privilege of being up on the big stage there with Dr. Sai Praveen Haranath, and we just hit it off. We were in the green room together, chatting and talking about geography and all these sort of aspects of medicine. And we just wanted to stay in touch. And so this conversation is sort of a continuation of our conversation in the green room. And for another time, the conversation we actually couldn't hear on the stage because the sound system was really hard to break through. We just wanted to reconnect, and it is a privilege. Let me just introduce a little bit about Dr. Haranath's background because it's quite incredible. First of all, he's a pulmonologist. He's an intensivist. He's a public health leader. He has a slew of degrees. He's a fellow in the American College of Chest Physicians. He's a senior consultant in pulmonology and critical care at Apollo Hospitals, by far India's largest health system. It's a network. It's not just hospitals. It's pharmacies. It's other, obviously, care centers throughout India. He is also, I might say, a consulting pulmonologist in critical care medicine here in the United States. to actually remote patient care using the best of technologies. So aside from caring for people who are critically ill and people dealing with advanced respiratory and critical care diseases, he is also a person who is a state-of-the-art pioneer in technologies. I don't know what Shah, you don't do, quite bluntly. I know that you practiced medicine in North Dakota and California. Where else have you practiced medicine, my friend, in the world?
Well, if you really want to know, the most unusual circumstance was over the Arabian Sea. We were flying from India to Dubai and connecting on to America. Somebody had chest pain on the flight, and as most doctors would respond, I did. The fun part of this is that, well, fun for me, was that they had Wi-Fi. So we actually got an EKG. And typically, many airlines will send their EKGs up to a center in the US. For some reason, the uplink didn't work. So they said, hey, do you have, is this okay? I said, it looks okay, but I can get a formal consult in 10 seconds. So I connected. So we have a command center in India, and it was 2 a.m. India, but it's always on. So I actually got my hospital cardiologist on a video conference consultation. We did a full evaluation of the patient, looked at the EKG, and we didn't have to divert, so which was good. And in fact, my boss, Sangeeta Reddy, she tweeted about it, because that really tells us that medicine can be practiced anywhere. And the reason I know that is in my remote critical care work that I do, I actually do it for a lot of small hospitals in rural America where they don't have an intensivist. They have a general practitioner or a PA or perhaps a nurse practitioner. And what I could see is that I would guess that 80% of care can be done remotely, is my guesstimate. And as AI comes in and as you start getting hardware AI, that's going to increase. Machines doing procedures. And I think it can all be done safely now. And of course, you have to train it, test it, regulate it, make sure it's all going right. But honestly, remote care to me can solve a lot of the access equity issues that we face, not just in poor countries, but everywhere. Because rural America is the same as rural anywhere. And it's fairly amazing. Because I lived for, like you mentioned, Gil, 4 years in North Dakota. I was a local town doc for several years. And it was beautiful to see people, farmers, going about their daily roles, come in for healthcare. There's nothing else. It's about living their life and taking care of health, etc. There's no other overlay of anything else that we hear about the news these days. And I think that's the kind of America no one sees. And it'll be interesting for people to really learn how much similar rural America is to the rest of the world. Not just in the good things, but also the challenges. That's very similar to what we see. And what I'm doing now, so the funny thing is I keep saying, hey, I was 15 years in America as an Indian. Now I'm back in India, 15 years as an American in India. So it's interesting that you're able to look at people in their hardest times. And at 2 a.m. in America, some small town in, say, the Midwest, I'm on camera talking to a family, explaining what's happening, helping them through that difficult process, because healthcare is very personal for everybody, and it's challenging for everybody. And we're forgetting that healthcare began and should be always laced with empathy and compassion. And it doesn't matter what technology you have, it doesn't matter if AI is there or not.
You're speaking my song. I'm sorry to interrupt you, but when we were there, I don't know if I gave you a copy of my book or not at the time.
You did. It was amazing. It was really good. It was amazing.
And I talk about how in this country, health has become way too transactional, and the relationship element that you've just been talking about has been stripped away from the healthcare professional. It's like throughput. It's like a supply chain of get it done, go to the next one. And I remember when we were waiting to go up on stage in Hyderabad that I was really taken by your sense of wanting to connect to people that you're caring for. And here you mentioned this again, that it's very personal. I sensed, look, I was in the city for this conference for 4 days. I met many physicians, none as charming as you, I might add, but many physicians. But I was really impressed with this intense feeling about connection to the patient. There was, even though we were dealing with high technology there, almost everybody was talking about kindness, empathy, relationship. Is that something that is just part of the culture of medicine in India? Was that like you got briefed before the big conference, like, hey, everybody, talk about kindness and empathy. That's your shared message. What was going on there? Because was really taken by that. And also, I found to a large extent that I was so impressed with, and maybe you'll talk about this, the Apollo hospital system, Apollo Health, was it's a system. It is obviously provides care, and it seems to have this very powerful culture. Could you talk about this approach of physicians and the approach of India's biggest health system, Apollo?
Thanks, Gil. So I think, if you really think about it, almost everybody gets into medicine because there's a calling of sorts. Yes, it's at some point you make money. It's usually 10 years after you start working. At some point, there is you advance in society. All those perks show up at some point. But it is a calling, it's a sacrifice, and it's a profession in the sense that really your day doesn't end at 5 p.m. Your mind's still thinking about what you saw, what you did, what you need to do. And so it's very different from a lot of other professions in that way. And from that standpoint, it's like soldiers. When you're in war, I mean, you're there. It's not always 9 to 5, right? So in a way, you're always fighting disease. And from that standpoint, almost every physician wants to do it with compassion and empathy. But I think it's time. The number of patients need to be seen. The number of people who need care is immense. And you really don't have as many providers. And like I mentioned to you earlier, I tend to go on tangents. Sometimes so many tangents we end up at the same point we started. But I think one point to remember is America has an older population. India's median age is 28, which means there's only about 75 million people, about 60, 65 in India now. Maybe in 7-8 years, there'll be 150 million, but there's about 1 billion Indians getting old in the next 30 years. There's 1 billion Africans getting old in the next 30 years. And the other number that gets me is 4.5 billion humans have no access to essential healthcare, half the world. So if you think about that, the work that needs to be done now and in the future is immense for healthcare. And so doctors and providers and health systems don't have much time. So there's always this push to get through things. And as medicine advances, as things advance, as new technology, new medicines, new ways to take care of things, the system hasn't organized itself more efficiently. We are seeing some inflection points now. Say ambient listening, for example, is able to auto-document, auto-record, auto-transcribe. Those kinds of things will play a big role. And then when technology is able to say measure vital signs through cameras, which you can do very well right now. In fact, you can also measure some biomarkers with cameras. Phenomenon for the geeks out there, it's called photoplethysmography. So you can actually through video pick up oxygen saturation, and I heard even about glucose and stuff. And there's companies who can, it's amazing just to think about this. From an EKG, you can pick up the heart failure. From an EKG, you can pick up glucose levels. And the most mind-boggling thing I read last week was about, I think it's from China. They did a study where they trained a bunch of EKGs with MRIs of the heart. And then they started generating MRI images from an EKG without doing an MRI. Imagine that. So just from the EKG, they were able to pull up. So technology is advancing. So I think there'll be a lot of levers for us to pull in to allow the doctor to have more eye contact. There's studies showing if you let the patient talk for the first time, 90 seconds or something, almost always you'll pick up the diagnosis. And also if you sit down and do eye contact with the patient, you're able to really, even if you spend 5 minutes, it'll feel like 20. And that, I think, is what we need to teach some little, human tricks to see what can we do to connect further. Switching to the second part of your question. And so really, the last comment was that I think medicine to me is a privilege to be a doctor, to be in healthcare, to be any kind of provider, because you're really at people's hardest times and you have the ability, if you do it right, to make a big difference. And it's not just about healing. It's also about palliation. It's about relief of pain, and really about allowing people to get the best version of themselves that they can be. Now, the other question you asked, now Apollo hospitals, when I moved back to India, I really, could go anywhere. At that time, I was, American trained, etc. So reasonably good market appeal. And then I picked Apollo for a couple of reasons. One, when I was growing up, my dad worked there, in fact, and he was a physician. And I used to hang out in his office when I was just entered med school. And so I kind of knew what the system did. And I always saw how global it was. Interesting story. So there was, when you look back on all our lives, there's always these points where something happened which made you go to the next step. And you won't know it at the moment. And when you think back, you kind of think, so this was, when I was thinking back, there was a time when my dad he was an internal medicine pulmonary doc too, and he ran a conference, a global conference in pulmonology, and there was a doc from the University of Washington, Seattle, who stopped in, and he was one of the speakers. And at that time, I was thinking of going to America, so I had a conversation with him, etc. So that happened. Then after that, I ended up in the US, and I ended up rotating with him. And he wrote me a beautiful letter with his colleagues, which got me into fellowship programs. And that got me to the next step, et cetera, et cetera. So these are things in life where, you're pushed along, you don't know it, but that's kind of what's happening. I think we're all, we're puppets in a way. But the other part, the other part of this is Apollo Hospital's that way. So when I came back, it was somewhat of a natural choice. And when I moved back, so I grew up in Chennai, India. I did med school there in Madras Medical College, and then I could go back there. But then my wife's family, almost everybody moved to Hyderabad. They had the movie business, so they figured out that Hyderabad's the place to be. And really, the reason we moved back, we want our kids to grow up with cousins and stuff, which is very difficult in large countries like the US, where we're all distributed. So we moved back, and I picked Apollo because Apollo, even at that time, was the leader. I think we were 4 or 5 years ahead of anything else, like the first PET scanner, the first CT scanner, the first proton, et cetera, et cetera. And now we're into genomics and AI, and we're inaugurating new hospitals. Like next week, there's a new facility coming in, which is we're really trying to position it as a futuristic hospital. There's a lot of these kinds of things we do ahead of time of everybody else. And this, I think, is what really drove me there. And like I talked to you earlier, Greg and Gil, you need mentors, you need leadership sponsorship to say, hey, go do what you want. They're difficult to get in most companies. And over here, I'm a champion for technology, for health, for doing it right in terms of healthcare, but my boss is the same. So they're Sangeeta Reddy, who runs the technology division as well as the clinics and many of our hospitals. So she's a joint managing director for Apollo Hospital. So she pretty much has these world-class ideas that she's ideating and then bringing to life. And she's inspired, and all of us are inspired by her father, Dr. Pratap Reddy, who is our chairman. He's in his early 90s, but works every day and has an immense memory and will ask you exactly what happened to your project and has deep insight into what's happening at every level of the ecosystem. So to me, Apollo was a perfect fit where I could use the advances that I learned in America, the approach that I learned in America, and immediately put it into practice in an Indian ecosystem. I think Apollo attracts doctors who like that model, because we have doctors trained in India from some of the best institutions. We have folks from Australia, the UK, etc. In fact, we now send doctors out to other countries. In fact, to the UK, we can train in India at Apollo and then go straight to the UK.
Just tuning in? You're right on time for Health Unabashed on Healthcare Now Radio. We're with Dr. Sai Praveen Haranath, Senior Vice President of Medical and Strategy at Apollo HealthAxis and Medical Director of Apollo eAccess, exploring what it really means to practice medicine without borders. From tele-critical care delivered across continents, to AI tools drawing on 50 million patient records, to the simple, irreplaceable power of a doctor who makes eye contact, Dr. Haranath is mapping a future where geography is no longer destiny and where empathy and innovation are not in conflict. Stay tuned, there's plenty more to come.
You hold a pretty important position at Apollo. You're very gracious and humble. You're a senior vice president, and you also hold the title sort of medical strategy in a way. So, I mean, it's not that you're just one of the many excellent doctors at Apollo. You obviously have added responsibility. Clearly medicine is a passion. You've talked a lot about your concern for patients with, critical illness or respiratory illness of some sort. How do you blend your clinical expertise with your responsibility to Apollo as a corporate SVP?
Thanks. So interesting. So Apollo has, well, if you go to the website and look at the annual report, there's multiple divisions of Apollo. So there is a division that just recently got started called Apollo HealthAxis. And I am SVP in this division, where I'm kind of helping out the medical insights into everything that we do. So Apollo HealthAxis' role is really to take the best of Apollo and give it to the world. And we call ourselves a provider partner. And we're helping with health technology. In fact, although I can't disclose who, but we are tied up with a large US health system to help with their health technology bits and kind of back end, but doing a little high end back end, if you want to put it that way. The other thing we do is virtual care. So you talked about virtual care. Now we are doing tele-critical care for the island of Fiji from India. We are doing tele-critical care for India. And in addition, within India itself, we're serving places in the Himalayas, for example, where we can do an EKG triage and decide the patient needs to come downhill or can they be treated locally. And the center that's watching it is from Chennai, in 3,000 kilometers away or 2,000 miles away. And then we have the AI bit. Because Apollo has this long tradition of preventive care for 40 years, we've had these master checkups, which was masterminded by Dr. Reddy 40 years ago. His approach had been to, we need to prevent this. And his story, if you read his book, it's called The Healer, it really started with a patient of his in India who could not get care, which was available locally, and he had to go to the US, but he couldn't get there on time and didn't make it. So that really triggered the Apollo hospitals in a way. And the AI bit started because of this. And so we have like 50 million records over several years, and we've built algorithms now to detect disease early, and these are getting deployed across the world. So these kinds of things are what drove me to Apollo HealthAxis. As a medical strategy guide for this division, I'm really helping out with figuring out what's meaningful, where can the pain points be fixed, where are the areas that someone needs assistance. And this comes from honestly, I think my experience in North Dakota and rural America, where I have been to obviously the metro side, in Connecticut and Chicago and Oregon, Portland, as well as in San Francisco, area, Walnut Creek, Kaiser there. And I look at the efficiencies that are there in some of these systems and the inefficiencies and say, these are things we can fix. Now, one thing people don't realize is people in India work a lot. I don't know if I told you this, Gil, when you were here, but the safest place to India, in my view, to be on a Sunday afternoon is a movie theater, because that's the time that all doctors are there. That's the only time they get off. They're kind of they're hanging out there. So I think it's funny. I mean, I thought it's I just made it up, but I keep getting confirmed on that. The other day, I took a 11 p.m. night. We have movies all weird hours because people can watch them whenever. So I had not watched this hit movie, and I ended up getting some time at like 10, 11 p.m. I sat in my seat and like next to me is my oncologist. Like, what the hell are you doing? The same thing you are. Get time. So there is interestingly, we do see one is Indians work a lot, 6.5 days a week, 6 days a week. The other thing is the time zone advantage. So I think the time zone advantage, because you're in India, we're 12 hours apart from the US, but also from other locations. There's a lot of things you can do when you're awake and help people who are sleeping. And sleep, as you know now, is a big thing. It's important to have all these influencers talking about, we always do, it's good to sleep.
Right.
But I think so that's the other reason. So Apollo to me allows me to do a lot of this. There's a lot of innovation happening. There's research happening. But ultimately, it's about the ability to actually serve patients anywhere in the world. I don't think any other health system can let me do that. So that's kind of why I'm sticking on. Long answer. My apologies.
No. Look, we're thrilled to hear your perspective. I wanted to get your take. I mean, obviously, you have a master's of public health. You're in the division of access. You have this big caring heart for patients. It comes across. India is a nation of many nations. People don't realize that. It's not that it has many states, but it has a multitude of cultures. We think of India as a country, or we call them, Indians. No, they're from India. But in India, people are very connected to their, the community focus, what group they came from, their subgroups. I mean, it's really almost a mosaic nation than anything else. I want to get your take on the broad economic swath. There are about 400 million people in India who are middle class and wealthier. That's more people than the United States in total. And then there's the other billion people. And when I was there, I was listening to some of the ministers of the state talk about the need to provide health equity and access to care. Could you share with us a little bit, because that's your focal point of your life, what Apollo and you are trying to do about that?
I think there's a lot of the cost of care which is artificial. A lot of the cost of the care is, I would say, probably not necessary. And I think what we've figured out is how do we drop all those out and really deliver high quality care, high touch care, high tech care, as long as you're able to get the outcomes you need and do it safely and efficiently. There are many health systems in the US doing it, and we do it very well in India. I think a lot of it is related to having the focus on making sure the patient doesn't pay the brunt of it. But even then, things can get expensive in India. At the same time, it's every patient in India needs the same, especially in COVID, we saw this. People need ECMO, which is super expensive. People need transplants, super expensive, difficult to get. But we are probably one of the world's largest transplant programs. We are probably one of the largest series of ECMOs in the world. We also have a very large number of robotic surgeries to do. On the other extreme, we also have a preventive care program. An example would be there's Dr. Pratap Reddy's birth village in Chittoor in southern India. We have a med school and a hospital we started there. And there's a program we call Total Health, where we're really taking care of all the social determinants of health and taking care of patients in their communities and even their education, etc. So there are programs like this. There are institutions doing free care for decades now. So there is a lot of community focus and ensuring that the cost of care can come down if you break away a lot of the unnecessary things. And there's a lot of unnecessary things. There's also some expectation settings. A lot of people are sometimes willing to wait a bit, but at the same time, I am seeing, I think, an inflection revolution that's going to happen where all the technology we have is going to really help us quite a bit. So from that standpoint, I think we're at a good place in medicine because you're going to have great solutions which are going to be affordable and available.
Wow, what a privilege to have you on this program, my friend. It was a great continuation of our conversation in that backstage area of Hyderabad and to bring you to the States. But I have a sense that you're here frequently, and thankfully you're here frequently seeing your patients here by way of telehealth. So it's a privilege to have you not on telehealth, but have you on Health Unabashed. What an honor for us. And I want us to stay in touch. I'd like to have you back again on the show and check in with you if that's okay.
Absolutely. Thank you again for the privilege, Gil and Greg. This has been amazing.
Thank you. Bye-bye.
And that, dear listeners, wraps another extraordinary conversation here on Health Unabashed. A heartfelt thank you to our global audience for tuning in and to our guest, Dr. Sai Praveen Haranath, for his candor, his compassion, his unwavering conviction that better healthcare for everyone everywhere is not only possible, but within reach. Dr. Haranath reminds us that the future of medicine is not just about what technology can do, it is about what medicine must never stop being: personal, empathetic, and fundamentally human. We also want to acknowledge a phrase that stayed with us from this conversation, one that deserves to echo well beyond this program. India's young will care for the old of the world. That is not just an aspiration. At Apollo, it is already a strategy in motion. To learn more about Dr. Sai Praveen Haranath and Apollo HealthAxis, visit apollohealthaccess.com or check him out on LinkedIn. Health Unabashed streams live on Healthcare Now Radio, Monday through Friday at 10:30 a.m., 6:30 p.m., and 2:30 a.m. Eastern. Want to stay connected? Follow Gil _Bash, and that's BASHE, and me, Greg Masters, MPH, and that's Greg with 2 G's, on Twitter. Tag your insights or feedback using the hashtag HealthUnabashed. Until next time, keep listening, keep learning, and keep raising your voice with no apologies.